Hi everyone, this is Mary Gregory with MAS Coding Solutions. Welcome to our educational video today, being sponsored by the Medical Coding Lounge. That is our private platform that we have for coders, all about coders. Today we're going to be we're going to take a little bit of a deep dive into pregnancy coding. And this actually going to be like a part one. We're going to talk about abnormal products of conception/abortion. This is the first section in the ICD-10-CM chapter 15, and so we want to cover a little bit of that. The definition, we're going to talk a little bit about definition. Abortion is the expulsion of or extraction of all or part of the placenta with or without an identifiable fetus. Now, an abortion, when it's a spontaneous abortion, we're talking 20 weeks or less. That can be a little bit different from your state laws, but when it comes to ICD-10-CM coding, a spontaneous abortion is 20 weeks gestational age or less. You can also have what they call a biochemical pregnancy. That is a pregnancy where it's really too early to tell if that pregnancy is going to be viable or not. And they base that on the HCGs. Then we have what we call ectopic pregnancies. These are pregnancies that's outside of the uterus. And then we have what we call molar pregnancies. These are pregnancies where we may have an ovum within the uterus, but that ovum doesn't develop into a baby. It would develop into a mole, or it could develop into some type of benign tumor. In ICD-10, you have codes O, starting with O001, your abdominal pregnancies. These are pregnancies that's actually in the abdominal area, it's outside of the uterus. Now, all these codes with these abnormal ectopic pregnancy, in ICD-10, we have codes for with and without an intrauterine pregnancy. So these codes can identify when someone have an ectopic pregnancy, in a pregnancy outside of the uterus, and they also have a pregnancy within the uterus. The one we code, we got abdominal, we got tubal, that's the fallopian tubes, we got the ovarian area as well, the ovaries. So they tried to cover all. Then of course you got other specified, and then you got unspecified. Personally, I don't know why they gave us an unspecified code, but I guess that could happen. We should know where it's at. Your default is always going to be without the uterine pregnancy, unless they specifically document that they have an intrauterine pregnancy with that ectopic pregnancy. The one we code the most often are the fallopian tubes. That's where the egg get hung in the tube itself, and they may or may not have to have surgery. Most of the time they're going to have some type of surgery to remove that ectopic pregnancy. Your ectopic pregnancy has to be identified whether it's left or right, because you usually don't have two fallopian tubes, one on the right, one on the left, and so they are going to identify it that way as well. Other abnormal products of conception, so you got your ectopic pregnancies, then you have your what they call the blighted ovum, and so your molar pregnancy is going to go in there. You have what they call a missed abortion, and we'll talk a little bit about that definition later on. You got your inappropriate changes in the HCG, and other abnormal products of conception. Missed abortion for ICD-10-CM coding. A missed abortion is considered to be early fetal death before 20 weeks of gestation with retention of the dead fetus. That's what a missed abortion is. And a missed abortion is that the patient still have the fetus. The fetus did not pass. When you have a spontaneous abortion, then generally they pass the fetus. Sometimes it's an incomplete passage. They don't pass it all, and they have to go in and do a D&C, and or they may do some type of medication to help to complete that spontaneous abortion. But when they have a missed abortion, they really have retained the fetus in this 20 weeks or less. And you might say, well, Mary, why are you harping on 20 weeks? Because in some states, it's more than 20 weeks. But for ICD-10 coding, it's 20 weeks or less. Anything after 20 weeks is considered to be an early fetal death. It's going to be coded out as an intrauterine death. So your state guidelines for what an abortion is can be different from your coding guideline. Also remember, for your elective abortion, I'm going to make sure I give you the right code, is Z33-2 is your elective abortion. Weeks of gestation is not a factor in coding an elective abortion, whereas missed abortion is 20 weeks or less. Spontaneous abortion generally going to occur before 20 weeks as well. But when you have an elective abortion, that's Z33.2, it can be any weeks. So you want to watch out for that. There are times when these abnormal products of conception can have complications as well. In ICD-10, they give you some very specific complications. Now, there could be more. We have pelvic infections. We have delayed or excessive hemorrhage. We have embolism. We have other specified complications. Renal failure can be associated with these. And even with if you have an elective abortion and then have a complication, then of course you're going to use the complication code. If the complication occurs during the time of the elective abortion, your Z33 is going to be primary, the complication is going to be secondary. Whereas if I have a missed abortion and I have a combination code that I'm going to use, that combination code is actually going to say, missed abortion with delayed hemorrhage. So, for instance, in spontaneous abortion, if you look at code 003.0, that is a genital tract and pelvic infection. So if my patient have a spontaneous abortion and have some type of pelvic infection, endometritis is one of them that you could think about, sapingitis is another one. If they have that infection, then I only need that one code, because that one code is going to tell them everything they need to know. It's going to tell them that patient has a 003. I hate these old codes. I mean, then try to do the zero right behind it. It's going to tell that it is following a incomplete spontaneous abortion. So see, that code going to tell you pretty much everything. Now, some people may also say, and I don't really have a problem with it, I tried to research it to see if there was anything in the coding clinics about this. Can I use an additional code with this to further identify the very specific type of infection that the patient may have? Because once again, this is a pelvic infection, and this pelvic infection can be an endometritis. This pelvic infection can be a sapingitis, or it could be just a UTI, who knows? So do I need an additional code to further identify the very specific type of infection that the patient has? I kind of think you can, but that's just me. Like I said, I did some research. When I do the next one, if I find out anything different, I'll let you know. So those are, you've got a very specific code too for sepsis following a incomplete spontaneous abortion, 003.37. And so once again, you have the various combination code where you can indicate if the patient is having some type of infection or complication going on. The other one I want to talk to you about is So we talked about spontaneous abortion. You can have spontaneous abortion. You can have an incomplete abortion. Or you can also have, if you go to 007, that's a failed attempted termination of pregnancy. Sometimes when a person have an induced abortion, it doesn't always work. It fails. And so they actually have a very specific code for that as well. Okay, so we've just talked about failed attempt abortion, how you have a code for that. 007 is your failed attempt termination. Now, you can actually use that code with the Z332. Of course, the Z332 would be primary. The failed attempt could be the 007, can be a secondary, or maybe they'll come back in thinking that the elected termination had worked and it had not. So kind of watch out for that. Let's talk a little bit more about the complete versus incomplete abortion. This is a coding rule, this is a coding guideline where it states that when the provider documentation does not specify whether the spontaneous abortion is complete or incomplete, we will be coding it out to that ICD-10 code that says complete or spontaneous or complete or unspecified. The fact, if that patient have a D&C or D&E, or they give them some type of suppository or some type of injection to complete that abortion, that spontaneous abortion, the rule is you cannot code it as incomplete without the physician documentation. So the physician has to actually document that it's incomplete. They say it's inappropriate for us coders to assume that it is incomplete just because of those procedures taking place. Okay? Then we talked a little bit, or we want to talk a little bit about the missed abortion. Now the big thing about the missed abortion is, once again, the patient has retained a dead fetus. And we have very specific codes that we use, procedural codes, to identify a missed abortion from a spontaneous abortion, especially in CPT. This may not be quite as true in PCS coding. So in CPT coding, if you have a spontaneous abortion, and they don't care what trimester it is, that CPT code is going to be 59812. Let's see, I want to make sure I got the right code there. That look like I'm short a digit. 59812 is the treatment of an incomplete abortion any trimester that you treated surgically with a D&C or a D&E. But when you have a missed abortion, your CPT code for a missed abortion is 59820. That's the first trimester. And then you have 59821 for the second trimester. So when you're dealing with a missed abortion, your diagnosis code, remember, missed abortion is any retention of a dead fetus that's 20 weeks or less. That's an ICD-10 coding guideline. Your law may say a different thing, but it might have a different set of weeks that they consider to be a spontaneous / missed abortion. But we have to code it based on the ICD-10 coding guidelines and not the law that's in your state. So be careful with that one. So always remember, if you're doing a missed abortion and you're doing a D&C or D&E on that missed abortion, then you have CPT wants you to code the procedure code based on whether it's a first trimester or second trimester. But with a spontaneous abortion, it doesn't matter what the code is. With your induced abortion, you have a CPT code for a D&C. You have that's 59840. You have a CPT code for when they give an injection. That's your 59851. Or suppository, 59856. Those are your CPT codes for when you are dealing with these procedures that is associated with these diagnoses. When you're doing your abortion codes, you have also complication codes. Anytime that abortion has a complication associated with it, it could be hemorrhaging, it could be an infection, it could be renal failure. So there's some different types of DVTs that could be deep vein thrombosis that could be associated with. You want to use those complication codes when appropriate to do so. So once points to remember. And ICD-10 rules may differ from individual state rules when it comes to classifying abortion. You got to code it based on ICD-10 guidelines and coding rules, not your state guidelines and coding rules, okay? Be careful with your documentation, because sometimes a physician would say they did a delivery at 18 weeks, even though they may use that term delivery. It's not a delivery if the fetus is 18 weeks or less, based on ICD-10-CM coding guidelines. So always remember that. It says, let's see what else. Just want to make sure that I did take care of that. Once again, be guided by your documentation on coding these abnormal products of conception. Especially now, I won't get to talk about the PCS coding, but we do have a PowerPoint presentation on this. If you'd like to learn more about it, this PowerPoint is associated with CEUs as well. If you want to purchase this PowerPoint. Now, I'm gonna get ready to close for today, but guess what, people? We are going to be starting our Beginner's Medical Coding Class 101 in March. We have partnered with the AAPC to use their learning management system, and so we are looking forward to training more coders. And we invite you to sign up and do our pre-registration on our website, www.mascodingsolutions.com, where you can pre-register. The class is coming in March. It's going to be a 16-week course. We are using the AAPCS Learning Management System. We have partnered with them, and we're looking forward to this partnership with the AAPC. So make sure you pre-register. The class size is going to be limited. It will be instructor-led. It's an online class, but we will have myself instructor-led at least once a week, going over questions that you may have, any concerns that you may have, any clarification that you may have. So I look forward to you. If you don't need this Medical Coding 101, you may know someone that needs Medical Coding 101. Do you know someone that's interested in getting into the coding arena and looking to get a good basic understanding and a good root system so that they can go out and become the best coders that they can become? Because remember, with coding, everything goes back to you understanding those coding guidelines and knowing how to apply the coding guidelines. So this course will certainly give you the basics that you need to become a great coder. I look forward to talking to you in the future. Don't forget to follow me, of course, on LinkedIn, Facebook, and TikTok if it's still around. And I'm on Snapchat as well. And what else I'm on? What's Up app. What's Up app. So I'm just getting all this techie out here in my old age, my mature age, at my maturity in this time. I look forward to talking to you all real soon.